I'm Dr. Shannon Dowler, Chief Medical Officer for North Carolina Medicaid and the Vulnerable Population Work Stream Leader for the Department of Health and Human Services and the COVID response. So we got a call from one of our community health center partners on Friday evening saying that they had noticed an increase in cases related to the plant workers in their community that they serve. And so as we dug into the numbers, we saw that in fact we were starting to see a trend and a rise in cases. So we wanted to partner with the local community to make sure that we did reasonable testing and surveillance to get ahead of this so that we can plan for where it might be traveling to next. So what we have is a consortium essentially that's come together on the ground to take care of this population and make sure that we're getting testing out to patients who might not otherwise have a medical home or nowhere to go for testing. And so it's a combination of a local federally qualified health center, Piedmont Health Services, the local health department, emergency management services. A couple of us from the state are here, as well as our support from the North Carolina National Guard.
My name is Lieutenant Colonel Bradley Merritt. I'm with the 42nd Civil Support Team, and I am the commander of the unit. Today we're here in Chatham County, North Carolina. We're supporting a drive-thru and walk-up COVID-19 testing facility. We're here supporting the Chatham County Emergency Management, the Department of Health and Human Services, the chicken processing plant, and also the Piedmont Health Services. We've been able to provide a lot of support to them. As soon as we walked in, they greeted us. They said, hey, we're glad you're here. Hey, what can you do to help us? And we were able to provide all of our equipment and all of our capabilities, and they were just really happy to have us on the ground.
It's been great to have the partnership with the Guard because we can come together as a community and say what we need, but mobilizing this quickly, generally speaking, when you do an outreach of this size, something for this many people, you might spend weeks or even a month planning for it, but we don't have the luxury of time right now. And so the Guard was able to sort of swoop in and help us with the logistics, so we knew that there were some pieces of it we would own and take care of, and then other pieces that the Guard would take care of for us. It's been a really smooth, streamlined process. It has been bad weather, so it's been rainy and cold and windy. So we hope as the weather clears, more folks will feel comfortable coming out.